I'm going to shift gears again.
Okay.
All right, a little bit. And I want to talk about your educational history.
Mm-hmm.
So can you tell me about your schooling?
Went to public elementary and middle and high school.
Mm-hmm.
Got my diploma. I like school. I was pretty good at it.
Good student? Yeah.
Yeah, it was okay. I mean, the anxiety definitely made it tough. I didn't always get the grades I wanted. And then, the drinking young kind of affected my attendance at some points. But I do like school.
All right. So you got through elementary school, middle school, high school, and now you're in college?
Yeah.
And how's that going?
It's okay. I like it. I like being surrounded by people and whatever. But it's really, really stressful. The coursework is tough.
Mm-hmm.
The professors are tough. A couple of my professors have confronted me about not coming to class or showing up and being hungover. And they're not as lenient when you miss assignments like they are in high school. There's always like, it's okay, do it again. That's really not applying in my program. So the experience is a little different.
What do you say when they confront you about the performance problems?
I generally just say, I have a lot on my plate and I'm trying to balance everything and I'm just really tired or exhausted, or I'll get it done.
Is performing better in school one of your goals?
Yeah.
We'll keep that in mind. I want to talk now, again, I'm going to switch gears a little bit to vocational history, like the history of working.
Okay.
Have you worked before?
Yeah.
Mm-hmm.
I babysat in high school. That was
Mm-hmm.
my main thing. And then I just worked at like a department store after school, like 1 or 2 days a week.
Mm-hmm.
And then like now that I'm in school, I'm not working as much, but I nanny sometimes.
Okay. And how do you felt that you've done with employment?
I think okay. I like to work.
Yeah.
Yeah, I don't mind it.
Has the anxiety or the alcohol use had any effect in that area?
Sometimes.
Yeah.
The anxiety is a lot at work usually, like performance or like the pressure of being there, knowing I have a boss to answer to, or if I do something wrong, especially like with nannying, working with the kids, I get worried I'm going to do something and they're going to get hurt, or there's been, it's just like all these scenarios could happen and that's stressful.
Have you ever lost employment because of the anxiety or the alcohol use?
I've given up things because I got uncomfortable or whatever.
So it's affected you in your education and in your work a bit?
Yeah.
All right. Does that concern you?
Yeah.
It does?
Yeah, a lot.
All right. Is that another goal, would be to address the
Yeah, for sure.
employment performance? Okay. What are you in college for?
Education.
And what do you want to do when you graduate?
I like kids, so maybe something like a school for little kids, early ed type of stuff.
Okay. All right, so I'm going to switch gears again a little bit here.
Okay.
Kind of move to some other areas. We've talked about the alcohol use,
Mm-hmm.
right? And that's something that you would like to work on, the focus of treatment.
Yeah.
Right? And then the anxiety.
Yeah.
Right. And you consider, in terms of the alcohol use, your goal there would be to use less or to discontinue use?
Less.
Use less. All right. And you mentioned to me earlier the age where you started drinking. Was it
14.
14. How has the drinking progressed from when you started using it at 14 to present day?
I think then it was more because I was hanging out with people that were doing it. It was kind of like a cut loose, have fun, fit in type of thing.
Mm-hmm.
And now it's more of a like helpful, it gives me peace of mind type of thing. And I would say it's probably more frequent now than it was then.
It's more frequent now?
Yeah.
Yeah. Does drinking reduce the anxiety?
It does. It makes it easier to just be out and have fun and not be consumed in my mind all the time.
Have you tried before going out and not drinking?
Yeah, I have.
And what happens?
I usually get uncomfortable, or I feel like I say something, or I can't talk, or I don't know, I just don't have a good time. I'm so tense and confused, and I end up feeling worse. It wasn't an enjoyable experience.
And those times when you do drink?
It helps me relax, and I get to have fun and not be like the girl with all the anxiety.
Right, so it's a better experience for you.
Yeah.
But as we discussed, Joy, in the long run, that's not working out so well.
No.
All right. All right. So before we get into the next section, I want to remind you again, any of the questions you don't want to answer, or if you'd rather talk about it later on, or not at all, just let me know that.
Okay.
All right? Because I'm getting into some areas that are a little more sensitive than some of the other areas we discussed
Okay.
to now. All right. So in this next section, I want to talk about your sexual history.
Mm-hmm.
Is that okay?
Yeah, that's fine.
Can you tell me at what age you first had consensual sex?
14.
14. All right. How about non-consensual?
I've never.
Never?
No.
Okay. In terms of legal history, have you ever had any involvement with law enforcement, criminal justice system?
Yeah.
You have.
Yeah.
You feel comfortable talking about that?
Yeah. I think I was like 14 or 15. It was right around when everything started. We were out and I shoplifted something from a store. So it ended up being an issue.
What happened?
We got caught, and they called our parents, and they called, like, the police came down, and so, and because we were drinking and we were shoplifting, so it was like underage and stealing, so it ended up like community service issues.
All right, that was when you were 14?
I think 14 or had just turned 15. It was right around that time.
Around that time. All right. Any other legal issues?
No, that's the main one.
That's the main one?
Yeah. Well, I'm probably the only one.
That's the only one?
Yeah.
All right. Were you left with any type of criminal record?
I don't think so.
Okay. Does your legal history ever come back to interfere with employment or anything now?
Not so far.
Not so far. All right. Okay. Do you have any history of military or government service?
No.
All right. How about your spiritual beliefs? Do you have any spiritual beliefs?
Yeah, I believe in God.
Believe in God?
Yeah.
Any specific religion?
I'm Catholic.
Catholic? Would you say you're practicing Catholic?
Well, no. I mean, yeah. I go when I need to.
You go when you need to?
Yeah.
All right. How important is Catholicism in your life? Is there spirituality in your life?
I would say it's there. It's not super important right now. I have other priorities, but it's there.
It's there?
Yeah.
Has your belief system changed throughout your life?
Mm-hmm.
No?
No.
All right. How about, I'm thinking of it, how about your family? Any spiritual beliefs in your family?
They're Catholic too.
Yeah. Your mother, your father,
Mhm.
sister,
Yep.
everybody?
They are. I mean, pretty much everybody's Catholic. Not everybody's like practicing, like you said, but yeah.
Has that been an influence on you?
I don't know. Maybe a little bit. I mean, we went, to services and stuff.
All right. Is there anything in your spiritual belief system that you feel like you could draw upon as a strength during treatment?
Maybe prayer.
Yeah? Okay. All right. So I want to ask you about your financial situation. So I'm shifting gears again.
Okay.
You mentioned you're not working right now.
Yeah.
Is that correct? Okay. How do you support yourself now?
My parents help me.
Do you live independently or with them?
I live on campus, but I'm only 15 minutes from home, so I go back and forth a lot.
And what's a lot?
Maybe like once a week I go home for something and come back 'cause it's so close.
Once a week?
Yeah.
Do you like that financial arrangement?
I don't love it, but it works for now.
It works?
Yeah.
What would be more ideal for you?
I'd like to be independent of them, taking care of myself. They would like that too. They've made that clear, so.
They made that clear to you?
Yeah.
And that's a goal of yours as well?
Yeah.
Okay. All right. All right. Again, I want to switch gears. I want to talk about your sleeping habits.
Okay.
All right. Do you feel like you get more sleep than you should, less, or the correct amount?
Probably more.
More? On average, how many hours do you sleep a night?
10, maybe?
And what would you like to sleep?
7 or 8.
How long has this been going on?
Probably college years, so 3 years maybe.
About 3 years?
Yeah.
Do you know why you sleep more than you want to?
I'm just exhausted and drained, and it turns my mind off, so it's a nice way to just block out everything.
Do you ever find yourself down? Like your mood down?
Sometimes.
Sometimes?
Not all the time, but sometimes. When the anxiety gets really bad.
When the anxiety's bad?
Yeah.
When was the last time you felt down?
Maybe 2 weeks ago.
How long ago?
2 weeks.
2 weeks? And how down were you?
I mean, I wasn't like depressed or anything, but I was kind of upset.
What does depressed look like?
I don't know, I guess like hiding out in my room, avoiding everybody, turning my phone off, sleeping.
But you indicated you weren't depressed, right?
Right.
So that's what you were doing?
No,
No.
no, I was just upset. I was more like sad or frustrated about a situation and the grade, and another one of my professors confronted me, and that made my anxiety worse. So then I was coming down on myself worse, and it was just like I just wanted to block everybody and everything out.
All right. So a bit down, but in your opinion, not depressed.
I don't think I was all the way to that point, no.
Did it change anything in terms of your drinking?
I tend to drink more the more upset I am.
Is that what happened this last time?
Yeah.
All right. Okay, I'm going to shift gears again. I want to ask you about your eating habits. Do you feel like you eat in a healthy manner?
Yeah.
Yeah.
A lot of eating on the run between classes and everything, so it's grabbing what's there and getting to the next thing.
Busy lifestyle?
Yeah, typical college student.
Do you feel like your appetite is stronger or weaker than it should be, or about where it should be?
I think it's pretty normal.
Normal?
Yeah.
Has there ever been a time when it has not been normal?
I don't think so.
No?
No.